take it out on me, not on her. Oh! Your dad can have her heart.
You can criticize House for many things: starting an affair with his ex while she was married, stabbing a patient with a syringe without their consent, or sacrificing a baby even though it was to save another's life. But you can never say he lacks persistence. If you're wondering why he got kicked in the crown jewels, let me explain. Very excited to be reacting to House MD Season 2, Episode 14, Sex Kills. On this channel, we are reacting to all 177 House videos. This will be episode 61. If I can't get the diagnosis before House, I have to have 2 tablespoons of my least favorite condiment, apple cider vinegar. I'm sure you'll support me. No time to waste. Let the show begin.
I'm having fun.
Look like you're having the time of your life.
I'm just a little nauseous. Can we take a break?
What did you eat?
Dad, what are you doing? It hurts. Let go.
The occasional drink. Doesn't bother me, but...
There's so much to decode here. Why was the girl feeling nauseous? How is there such an age difference between her and her dad? Who's gonna finish the bridge game now? It seems like the dad had a vacant episode, but while squeezing his arm and losing awareness, very unusual. If it weren't for the arm squeezing, I would say this was what we call an absence seizure. Usually it happens in children, tend to last just a few seconds of them staring into space, stopping mid-sentence and then just carrying on as if nothing happened. Usually it does improve as people get older, so it would be very unusual to get them in an older gen. So what could it be? Let's get some more clues.
You had what's called an absence seizure.
Would you mind closing the blinds?
His right testicle was almost twice as big as his left.
Sure, if you call a micro abscess in his brain clean.
So his scrotum may as well be the second coming of Biggie Smalls, and his brain has become an oversized petri dish. What does that all mean? House may think what he's seeing is a micro abscess, which is a small walled off focus of infection, but it may be something else like a bleed or a stroke. Either way, it could point to an infection in the heart, so you'd definitely want to scan that next and do a full neurological exam to see whether his brain is working between his absent seizures. What about his crown jewels? The first thing we think of when there's a discrepancy in size is cancer. Although it is normal for one testicle to be slightly bigger up to the size of a teaspoon, testicular cancer is most likely at 25 to 39 and starts dropping off afterwards, so is quite unlikely in this patient. This case reminds me of a 42-year-old Polish patient I saw in my clinic though. He told me he had had a problem with his testicle for a couple of years, and when I examined him, the left testicle was around 10 times the size of the right. I sent him for an urgent ultrasound which showed he had what's called a hydrocele. It's where fluid accumulates in the sac that surrounds the testicles. Thankfully that's a benign condition, but it was still sent to urology to consider draining it. That's important as using the penis is pretty tough when there's a giant boulder enveloping it.
Blood and urine were negative for syphilis, gonorrhea, and chlamydia.
So treat him for all 3.
I want to get Depo-Provera.
High dose of Depo-Provera will chemically castrate you.
I love cows.
Make love, not belts. It's beautiful.
Whoa, 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 whoa. I have some serious beef with that guy. I think he misinterpreted taking the bull by the horns. These clinic scenes. So the Depo-Provera should be used as a contraceptive for women. It's an injection of progesterone into the muscle. It lasts 3 months and works by preventing an egg from being released and thickening the mucus in the womb, making it harder for sperm to enter. When you give it to a man, it inhibits the production of testosterone and reduces the sex drive and sexual thoughts. It's been experimented with in the past for sex offenders as an alternative to prison to try and rehabilitate them. One study showed that the use of it reduced the reoffense rate from 58% to 35%, which is quite significant. Depo-Provera wasn't the first to be used though, and castrating prisoners stretches all the way back hundreds of years. The eye for an eye principle meant that rapists had their testicles removed as punishment for centuries. That did lose favor in the early parts of the 20th century, however, and was replaced with forced sterilization. Undesirables that society didn't want to reproduce were made so that they couldn't. This is called eugenic sterilization, and 13 states in the US still have them on their law books, even though they aren't used, partly because the Constitution disallows cruel and unusual punishment, and so many federal district courts have repealed attempts of castrating prisoners. One judge actually said back in 1910, vasectomy itself is not cruel, but when resorted to as a punishment, it is ignominious and degrading, and in that sense is cruel. When the penalty is paid, when the offender is free to resume their place in society, he should not be handicapped by the consciousness that he bears on his person and will carry to his grave, a mutilation which, as punishment, is a brand of infamy. So a question for you smart people: should castration or sterilization of prisoners convicted of sex crimes be allowed? Answers down below.
I have not had sex since my divorce.
People have impulse control. We don't need sex. I hear you'd rather die than admit you had sex.
I'm sorry, I couldn't tell my daughter.
Last card!
Is this another seizure?
Shut up. 40 milligrams furosemide.
Wow, they've treated him for every STI under the sun, which he's negative for, and now he's spitting fluid into his lungs. Since the episode is titled Sex Kills, then the top diagnosis would be some kind of HIV-related heart failure, but they said he was negative for all their tests, which is odd. He started out with seizures, so whatever this is must be a multi-system disease, not just the heart. So if it's not STIs, what else could it be? Maybe it's something else related to sex rather than simple infections themselves, like the physical act of sex or the fact that they're hiding it. The man said he met the lady at a cheese tasting mixer, so what if it's cheese that triggered all of this? The patient is fairly elderly, could have Parkinson's disease and be taking a medication called a monoamine oxidase inhibitor, which interacts with cheese and causes a high blood pressure crisis, leading to heart failure and potentially the seizure. That has to be my first diagnostic guess. It's niche, it's spicy, it matches the story. Sex doesn't kill, but cheese mixers will unalive you faster than you can say lactose intolerant. I like it, let's go with that.
Which is hard. Your vegetation's obstructing his mitral valve.
Way to a man's heart is through his stomach. That Italian cheese thing at the church. What sort of cheese? Tastes like this?
Oh, yeah.
That stuff will give you brucellosis.
I mean, nobody else at the church got sick.
You were taking antacids for your acid reflux. Turned your digestive tract into a pleasant scenic river.
Oh, I had a feeling it was the cheese, but I wasn't quite there with the infection rather than the hypertension. So House thinks the patient was affected and not the others at the party because he's taking a med that reduces stomach acid. So do antacids increase the risk of digestive infections? Absolutely yes. It's a surprisingly under-accounted for side effect, and a study looking at very popular medicines for this, like omeprazole or lansoprazole, found that patients on these meds were 6 times more likely to get GI infections than those who weren't. Definitely not one to just continue taking. Brucellosis that House mentioned is transmitted through contaminated animal products and can cause fever, joint pain and fatigue. It does resolve with antibiotics, but it takes months as it's quite a slow growing bacteria. They did say this cheese mixer event was a while ago in the episode as well, so pretty good medical accuracy there from the writers. There are definitely other things that can cause infection in his heart though, so let's get some clues to see what they might be.
Paddles. Charging. 250. Clear. His heart is back in sinus rhythm. There's a lot of damage though.
It was brucellosis, but we got to it too late.
So, all he needs is a heart, and he's out of here.
They voted no. Might have a week.
Oh yeah, so the chances that a heart transplant match can be done on someone over 65, which this guy is, are very slim. Age generally is not a factor on its own, but people of more advanced age are more likely to have another condition that makes the transplant too risky. That includes diabetes, high blood pressure, or reduced kidney function. On the positive side, his testicles, brain, and kidney function have improved after the antibiotics for the brucellosis, but not enough to make him qualify. qualify. What if hearts weren't so scarce? Would we have such a strict requirement? Well, the likelihood is no. That's why we're looking for new sources of transplants, and you may have heard recently that a pig heart was successfully transplanted into a human in the University of Maryland. The patient only survived 2 months after the surgery though. They used genetically modified pigs as the source to try and reduce the chances of rejection to get a match, but clearly the tech needs more work. Another potential source now is an artificial heart, but they wear out very quickly. Remember, your heart is beating 80 times a minute, 4,800 times an hour, 115,000 times a day. So any mechanical valve that doesn't have that natural, stretchy, regenerative tissue that our heart has can wear out very quickly. The longest an artificial heart has lasted in history is 4 years, and that's a record. To stop these from wearing out, there is a company called Bivacor that's trying to create a levitated rotating disc held up by magnets to reduce the amount of wear on the joints themselves. The tech isn't quite there yet, but we aren't far away, so maybe in 20 years this will be a problem of the past. Although House is basically 20 years old and we still haven't solved it.
I think I broke my ankle. I was kicked by a hoof. People who actually have this condition rationalize it. They dismiss it. They don't elevate it to the level of poetry. Plus, there's a wooden splinter in there. So either you hit yourself with a 2x4 or Elsie has a pig leg.
I'm sick. And you're a doctor. You have a duty to help me.
We've seen this condition before, Munchausen syndrome. This patient wants all the medical attention he can get, and it doesn't matter how many planks of wood he needs to hit himself with to get it. The condition he's faking though is actually quite interesting. There's a TV program that was on recently called My Strange Addiction, and in it there was a man who had sex with his car. He even called his car Chase. Not sure how our Australian heartthrob would feel about two-way exhaust pipes. The condition though is called objectophilia and is linked with autistic spectrum disorder. A car can't fight back though, but if you touch a cow the wrong way, then you'll need more than a hormone injection to feel normal again.
60% of potential donor hearts get tossed in the trash because there's something wrong with them. With fat people, it's closer to 80. Big, fat, sloppy heart beats no heart at all.
Every year, less than 10% of people who need a heart transplant actually get one. Part of the reason why they're so scarce is because House is right. 2/3 of donor hearts are discarded. There are a few reasons for this: too small, some degree of heart failure or thick heart muscle, or the patient had high blood pressure. The decision tends to sit with the individual surgeon assessing the case, which means that there isn't much consistency in why they were thrown away. What's even more insane is that there's evidence that these same criteria that people reject hearts for make little or no difference to the outcomes after surgery, which is definitely something to consider, especially when 50% of heart transplant patients are alive 11 years after the surgery. That's a lot of potential human lifetime being fed to the dogs.
I'm sorry for your loss, but I need your wife's heart. Wait, what are you doing?
I am taking her off the machines now.
This girl's father will die by next weekend unless he gets your wife's heart. Take it out on me, not on her. Oh! Your dad can have her heart.
You can criticize House for many things: starting an affair with his ex while she was married, stabbing a patient with a syringe without their consent, or sacrificing a baby even though it was to save another's life. But you can never say he lacks persistence. If you're wondering why he got kicked in the crown jewels, let me explain. The transplant coordinator basically rejected the organ of this guy's wife because the patient was overweight and had hepatitis C. So they were about to switch the ventilator off, and they did. Then House switched it back on at the last second. He also emotionally manipulated the husband here by getting the patient's daughter to switch on the charms. This is going to be a very risky transplant though, as we're not quite sure what was going on with her either. She also had fever, stomach pain, and raised liver enzyme, sort of similar to our patient. Maybe they have the same disease. Let's find out.
Whatever made her sick will kill him.
We're going to cure her.
Could be a gallbladder infection.
Do an MRI, stat.
I assume House is a great doctor. When you're that big a jerk, you're either great or unemployed.
This guy has known House for less than a day and has already figured him out. Gallbladder infection is a pretty good diagnostic guess from Chase. It's a tiny organ just under the liver that holds bile that breaks down fats in our foods. As many as 1 in 5 of us can get stones there, which get stuck in the gallbladder exit and cause problems. If that blockage where the stone gets stuck is in the opening of the gallbladder itself, then the patient gets cholecystitis, which means inflammation of the gallbladder. We were taught a mnemonic in medical school that's been in use since the 1950s that helps us remember the type of patient most at risk. We used to call it the 4 Fs of cholecystitis: female, fat, 40 and fertile. This was based on a 1950s study by the British Medical Association that found overweight women who had children were most likely to get it. There's so much nuance that this mnemonic doesn't include though, like Native American and Mexican American women are 2 to 3 times more likely to get gallstones than Caucasian women. Family history is actually one of the strongest risk factors as well, and it's not included in the mnemonic. Also, after 50, women without children become more likely to get gallstones. Also, what about the fat in the mnemonic? What's most important rather than the weight itself is recent changes in weight, like massive weight gain or loss. They're doing an MRI here because they love spending money, but an ultrasound would be adequate as a first step. Really unconventional episode structures.
No sign of gallbladder infection, but there was a cyst, perfectly round.
What if she was sloppy about washing her hands after pooping?
Amoeba infection?
Okay, how did they mistake a liver abscess as hepatitis? That's like calling a pigeon a gazelle. There are generally 3 things that can cause a liver abscess: bacterial, echinococcal, and amoebic. To get a bacterial abscess in the liver, it usually is because of leakage from the bowel into the abdomen, which then travels up the liver. Amoebic and echinococcal abscesses are both by ingesting contaminated matter. Echinococcus parasitic cysts can be contracted from petting dogs or putting your hand on contaminated grass. Amoebiasis is from coming into contact and ingesting parts of contaminated feces. It can cause these nice round abscesses that House was mentioning and can be killed with some IV meds like paramycin. Echinococcus looks very different as it makes what's called a hydatid cyst that has these compartments which we call septations. Moral of the story, wash your hands before you eat.
You don't really worship cows.
It's my mom.
Either that's a very old photograph or it's your stepmom.
She goes around the house in a bikini, or less. She'll give me a massage. I can't walk for an hour. I just need the medicine for 3 months until I graduate and I move out of the house.
I'd just like you all to remember, someone wrote this! Writer, if you're watching this, I don't know what happened to you, but I want to know your story. I mean, it's clear that's his stepmom, not his actual mom, but if that escalates, then dad won't be organizing a Thanksgiving anytime soon. Now, if you're thankful for this channel, then check out the channel membership. You get priority access to new videos, access to exclusive polls, and to suggest another series and episode for me to react to. The first 30 members have a chance to win a 1-hour one-on-one tutor session with me on a topic of your choice. We have gained 3 members since the last video and currently have a 24 with 6 spots left. So press join now to secure your spot. I'll keep working tirelessly to make it worth your while.
Looks like local hypokinesis.
Stop the meds. You can pull the plug now.
No!
Just gotta save that guy.
Come on. Did your wife dye her hair?
No.
Guess this must be yours then.
No way. Okay, this is rare, but there are a small subset of patients who, after having hair dye, will develop autoimmunity, which includes lupus or, more likely in her case, primary biliary cirrhosis. That will be my second diagnostic guess on our second patient of the episode. It's an autoimmune condition that can attack the gallbladder and liver, causing failure. An active ingredient called paraphenylenediamine is known to trigger allergies and in rare cases stimulates the immune system to attack the body. If that's the case and she does have primary biliary cirrhosis, then a test for a specific antibody called antimitochondrial antibody would help to diagnose it. A medication called ursodeoxycholic acid can help, which is a bile salt that helps desaturate cholesterol and reduce damage to the liver. I find it so interesting that the husband to the patient really wants to have his wife help the man and leave a legacy. I am a bit worried about what message that sends though. It's like, if someone dies, then that means that we didn't fight for them hard enough. But in reality, sometimes it doesn't matter how hard you fight, the odds are stacked too far against your favor. That being said though, you can appreciate the man's tenacity. The true question is, how many people would sacrifice themselves to help another person? There was a Mr. Beast poll that recently asked, if you offered $10,000, would you take it if you knew someone random in the world died? 55% of people said yes. Would you? If so, why? Answers down below.
Mr. Arrington? His heart's not pumping enough blood to his brain. We're gonna have to give it some help.
Laura must have confiscated them.
This, at least, is interesting.
It isn't helpful. Teenage boys aren't toxins. What if the cyst isn't a cyst?
Wait. I said this on a previous episode and it worked so perfectly there, but wasn't the diagnosis. This episode is called Sex Kills, and she has been having sex with her students. She has a liver mass. My third diagnostic guess, hepatic ectopic pregnancy. An egg gets released and our fresh champion swimmers fertilize it. Most of the time they will implant in the lining of the womb, but slightly less commonly than teenagers, 1% of them get lost. Mostly they find themselves in the fallopian tubes, but sometimes, rarely, they really go off the beaten track and land in the bowel or even the liver. If that's true, then they'd need a medical termination with methotrexate, and that could fix the problem. Other options though, now we know she's been sleeping around, are things like chlamydia, gonorrhea, syphilis, HIV, pelvic inflammatory disease. The possibilities are endless.
What if it's a scar? Fitzhugh-Curtis syndrome? Pushing gonorrhea again?
She's positive for gonorrhea.
He's in a coma.
I need 2 ORs and the transplant team. She had amoebiasis. Found a different way to get rid of it. As soon as his wife's heart's in our hands, you can tell him about the gonorrhea.
Gonorrhea? Gonorrhea? From a student? Now we know what the hair dye was for. This transplant may seem sudden and rushed, but in real life that is actually how it is. I was doing some overnight surgical cover in Sheffield about 3 years back. I was on call for vascular, plastics and transplant for that shift. At around 2 a.m. we got news that a kidney had just become available. We had to rush straight away and I assisted the transplant surgeon in putting this kidney in for a patient. The whole thing lasted about 3 hours and honestly it was the most satisfying surgery I'd experienced. Knowing this person in front of me had gone from needing dialysis 3 times a week to now just needing to take a tablet every morning was pretty mind-blowing. This procedure though didn't seem quite as clean. Would you like a side order of gonorrhea with your hot?
I had a one-night stand. I got gonorrhea. That's what made her sick, and that was why she got into the accident.
Cecile?
If you do mom again, you gotta wear a condom.
Could I stay with you for a few days? She's been having an affair.
I love how the house writers reflect the patient stories to the clinic stories to the doctor's stories. The way they theme each episode is just brilliant. Yes, the medicine may not be 100% perfect at all points, but of all the medical dramas I've seen, it has to be the most accurate. I'd say 7.5 out of 10 entertainment, 7 out of 10 accuracy, and a 6 out of 10 diagnosis for this episode. I really didn't have much time to get brucellosis, and I was out of guesses for gonorrhea, even though I suspected it. These season 2 episodes are really testing me. This episode really only makes sense though when you watch the previous one where House treats the perfect girl here